RenoVation Medical Spa is proud to introduce Voluma XC, a non-surgical solution to correct age-related volume loss in the mid-face. With this innovative product, you'll see immediate natural-looking results that last up to 2 years. We are the leading provider of the Voluma XC product in Northern Nevada, and our team has the knowledge, experience, and attention to detail to make sure you get the best possible results. This, together with the expert oversight of Dr. Charles Verdon, will make sure you get the right treatment and look your best.
Since fillers came along, they've gotten better each time, and what we now have, a new substance called Voluma, is actually a HA or hyaluronic acid based product that's stiffer, that's stronger. They cross-linked it better, and it's going to last longer. And now we have the first compound that has been approved for mid-face enhancement. Why the others before hadn't really been able to handle that is they weren't strong enough. You'd have to use a lot of volume. So we're going to keep the indications for Juvederm to the same as they were, meaning lips, nasolabial folds, parentheses, or marionette lines. But we're going to use Voluma almost specifically now for mid-face enhancement. That's where it's been described to be most useful and have its biggest impact. We've seen in trials these lasting now up to 2 years. That's phenomenal. That's a new thing for us to kind of make your money be used in its wisest way in a non-surgical fashion. It's not taking the place of surgery if surgery is indicated, but it could buy younger people time before they would need something. And that's what's exciting about it. It's a non-surgical option to kind of a cheek lifting experience. Kind of the malar area and the defining lines between the lateral canthus and the corner of the mouth. The areas that we really kind of want to focus on are building these areas up in here. There really isn't a lot of downtime. There sometimes is a little bit of injection, post-injection lumpiness and irregularity that may last a week or two. Oftentimes it's little blood vessels under the skin that create a little harder reaction that goes away. So we tell our folks, within 2 weeks, you should have everything settled down. But most of the time, you can, within just a few hours, head off to a dinner party or be out with friends and family. So a little word about the kind of technique she's using. If you notice, she's coming straight in and then creating volume and then moving and coming straight in and removing and making volume. That's probably more accurate than a drive the needle in and drag back technique across a curved area. So technically what we're trying to do is build little tiny mountains that are all congruent so they match. That's pretty much a technical issue and very important in trying to create equal volumes on both sides. She's paying attention on the syringe as to how much is going in each little location. And then you can see she pushes and rubs it, and that's kind of dispersing that compound into a uniform placement underneath the soft tissue. This is a deep injection as opposed to a in the dermis or a superficial injection. The art of where to put it, how to avoid vessels and nerves, how to build on somebody's own structure, what layers to put it in, are all part of years and years of training. And I know Darcy doesn't like to brag on herself, so I will. She's been a certified injector for 12 years and literally has done thousands and thousands of injections. And so she not only is making the procedure comfortable for Alyssa, but behind her eyes are years and years of experience in how to layer this volume in and how to make it most effective. The other thing that a product like this allows you to do is this: most faces are a little asymmetrical by nature, and if we were to be real critical about each and every one of our faces, we'd see our orbits are a little different, the sides of our face are a little different, one brow might be a little higher than another. With fillers, we have the ability to help with some of those asymmetries. You can see it's a very bloodless procedure. We did not block it with a agent before to keep bleeding to a minimal. When you use very small needles and you stay vertical, you rarely hit them. And if you were to hit one and you were to have a little bit of a bruise, it wouldn't be uncommon. What we do when we have that happen is we just keep pressure on that for a minute or two and it stops it. And this is why it's important to tell our patients to not have been on blood thinners. Aspirin, Motrin, Aleve, any of the anti-inflammatories, Relafin for arthritis, things like that, fish oil. We want to keep our patients bruising to a minimum, and so we are checking with them pre-injection to make sure they've been off of those compounds. So no downtime, immediate result, and really very little risk involved. It's just the genuinely unique message for Voluma is the extended time you're going to get it in the tissue. That's the big push here.
I just had the Voluma XC treatment and I love it here at RenoVations at Dr. Verdon's Medical Spa, and it was instant. There's no downtime. I just had it done, put a little powder on, and I'm ready to go. So I love how I look.
For more information on Voluma XC or any of our other services, call us, visit our website, or stop by the spa. We look forward to meeting with you and delighting you with our personalized service and attention to your needs.